Thanks for tuning in to the Drive On podcast, where we are focused on giving hope and strength to the entire military community. Whether you're a veteran, active duty, guard, reserve, or a family member, this podcast will share inspirational stories and resources that are useful to you. I'm your host, Scott DeLuzio, and now let's get on with the show. Hey everyone, welcome back to Drive On. I'm your host, Scott DeLuzio, and today my guest is Dr. Sarah Michaud. Dr. Michaud is a seasoned psychologist with over 30 years of experience and a deep understanding of some of the issues that veterans face, such as addiction and codependency. And today we'll discuss how those issues impact veterans and their families and what steps can be taken to develop healthier relationships and coping mechanisms with regards to these types of issues. So before we do that, Sarah, I'm really glad to have you here. Welcome to the show.
Thanks so much. I'm really glad to be here, Scott. I thank you for inviting me. I have a special place in my heart for veterans. My dad was in World War II, and I don't know. I just hope I can be helpful.
Well, I think so. Based on some of the stuff I've kind of looked up and conversations that we've had kind of offline before we started recording here. I think this is going to be a great conversation. I think it's going to be
Yes.
especially helpful for those folks who might be struggling with addiction, codependency issues, that type of thing. So,
Absolutely.
I guess before we get into it, I think a lot of people are probably familiar with addiction and like what that is, like they kind of
Right.
can conceptualize it.
Yep.
Codependency is one of those terms that I think maybe is maybe not as commonly used and as familiar
Right.
to folks. Can you start
Right.
with explaining what codependency is and
Sure.
how it manifests in folks?
Absolutely. I would be happy to. And the problem with codependency these days is it's kind of become part of the lexicon. I mean, everybody's throwing the term around. So it's kind of lost its meaning. I mean, it originally was developed really by Bill Wilson, who started Alcoholics Anonymous. His wife was kind of the first person who started talking about it, meaning what is the personality or the traits of the person that's the partner of someone with a substance abuse problem? That's where it began. And then in the kind of 60s, 70s, and 80s, these books were written about codependency, and it was initially a partner of a substance abuser. So basically, the person was focused more on their partner's thoughts, feelings, and behaviors rather than their own. And that caused a lot of problems, which we can discuss, because the problem with that paradigm is it doesn't work. So the classic kind of housewife would spend all their time worrying and trying to fix their husband and get them sober. And meanwhile, the husband would just get resentful and the wife would go down the tubes. So it never really worked out. And then as time has evolved, codependency has been more kind of brought into the general arena of relationships because, people, first of all, it's not only women. And secondly, it's really where anyone can kind of focus way too much on someone else and trying to fix them or save them or change them. So that's what it's really about. It's where my life's focus is way more now on my partner and thinking they need to change rather than focusing on myself. So that's really the definition now. And in the process, the person loses who they are. We really lose our connection to ourselves. Meanwhile, our connection to others and everybody else. So it's really the lack of ability to be who you really want to be. Okay, I'm getting complex now, but yeah.
No, that was a good explanation, I think. Because when you're talking about these concepts, I want to make sure that people understand kind of
Yes,
what it is, and before we start just diving into it and talking about
absolutely.
solutions or things like that, we gotta have to identify the
Yes.
problem first, right? And I think, like I said, addiction I think is fairly commonly understood.
Yeah.
Codependency, maybe perhaps not as much. Maybe the concept is, but maybe the label might not
Yes.
be there,
The
right?
word.
Yeah,
Yes.
exactly. So this sounds like the way you described it, it's not necessarily just uh dealing with a spouse or a close relative
No.
or some loved one with addiction. It could be any issue that they're
Yes.
going through that you're now, I need to figure out how to fix this.
Yes.
And the reason why I wanted you to kind of go into that, I kind of, this was kind of a loaded question. I kind of knew the answer when I asked you to describe what codependency is, but
Right.
um, I did that because I know that there's some listeners out there who have a loved one who
Yes.
is struggling with something. Maybe it's PTSD, maybe it's
Yes.
addiction, maybe it's who knows, you name it. They're dealing with something, and that person either doesn't want to go and find the help or they don't know where to go. And
Yes.
this other person, this loved one, is like, I need to help them. I
I
need to do
know.
something to help them, you know. And so I wanna identify this as potentially a problem, that might affect them, and I'm not saying it's a problem that you wanna help somebody, like, that's obviously it's a good thing, but where does it become a problem? And I'm sure
Yes.
we'll get into that at some point, here, but that's kinda why I wanted to bring this up
Yes.
and kinda get the ball rolling on this conversation, so, um,
Yes. Yes.
but
Eh, go
yeah, go
ahead.
ahead.
I was
No, go
gonna
ahead, go
say,
ahead.
and I said this to you before we came on. My best friend was married to a Vietnam vet for 30 years. And she actually, I spoke with her last week, and she was in a group at a veterans center for wives of disabled veterans. And she said basically the whole group was discussing codependency. So even though it may not be labeled a codependent group as a support to veterans, a lot of the issues are going to be around codependency because, and I think I was thinking about this, thinking about being on your podcast, that it's almost like codependency and addiction magnified. That's what it's like being in the veteran world because you're not only dealing with addiction, you're dealing with depression, you're dealing with PTSD, you're dealing with chronic pain, you're dealing with pain meds, you're dealing with TBI, you're dealing with grief, rage, loss of identity. I mean, I could go on and on about all the challenges that are physical problems, physical disabilities.
Right.
So there are so many issues that one can be codependent with a partner around. And, plus, let alone kind of, I was going to say violence and some other possibilities. So it's kind of like everything magnified. That's how I see like the veteran work around codependency and addiction because it's complex.
It is complex, and oftentimes there's more than one issue at
Yes.
play here. Like you talked about physical issues where you might have, chronic pain, and
Yes.
so that's an issue that you're dealing with, but then you're prescribed medications, and then if you're overusing those or getting addicted to those medications, that
Yes.
becomes another issue, and
Yes.
now you have that, and then how are those medications affecting you? Are you becoming, irritable and violent and
Yes.
you name it, all these different issues. Now we got a third
Yes.
issue. Now and you could see how this
Absolutely.
snowballs down the hill, right? So,
Yes.
um,
Yes.
so let, let's talk about the addiction side of things and maybe the over medication, the way
Yeah.
things are. A lot of times
Yeah.
veterans are prescribed numerous medications
Yes.
by either the VA or other doctors, and sometimes it's unnecessary what they get prescribed. How does this contribute to some of these issues that we're talking
Yeah.
about?
I mean, it's so tricky because you really can't look and at least this is my opinion, and you're going to get many opinions.
Sure.
And it's also tricky specifically of veterans too. But I always say it's very hard to deal with the other issues, the depression, the PTSD, the rage, all those other things, if you're continuing to participate in an addiction.
Mhm.
So if you can't put the addiction down first, and I was looking at statistics, Scott, with the veterans. I mean, my gosh, you probably already know this. You probably had people on your show. I mean, like substances over 50%, suicidality. I mean, it's just insane. Like the
Mhm.
high level of PTSD, what, 1 in 3 or over 75% or something. So there are a lot of other issues. And the trouble with PTSD and addiction very often is if you put down a substance, say alcohol, and you may know this, you may know other people who've done this, sometimes the PTSD then gets worse. because now I don't have anything to medicate all of my symptoms.
Right.
So it's kind of like this really tough bind, right? Well, Sarah, you're telling me to put down my alcohol, but now I'm going to start having nightmares. Okay. So, what do we do first? So, it's a real delicate dance in the veteran community to me to figure out how to get support around putting the substances down and the addictions. And then concomitantly, we're going to try to manage and stabilize symptoms so someone can really work on their recovery and sobriety. So it's tricky. You're talking about pain meds also. And I actually was married to a guy who was a Navy vet, and he got all kinds of pain meds from the VA. And he was someone in recovery. And it was a very tricky situation. I haven't sent you my book yet, but he relapsed. And when I met him, he had 15 years of recovery. And a lot of that was around pain and pain meds and the abuse of pain meds. And especially
Right.
now, well, you know, all those issues now we're having. So it can be very tricky, and without getting into the VA and, you know, all that stuff, I just think the solution they believe is add another med. And I've seen people for years that come in and they're on 5 different meds. And it's like, but what are we really looking at here? And it's, you need to get to those, what I call the underlying causes and conditions.
Exactly. And I hate hearing this when I see someone who goes to the doctor, they have condition A, whatever it
Yes,
is, right? And they get prescribed something for that condition. And that
yes,
condition might improve a little bit, but
yes,
then that medication has a side effect of
yes,
something, whatever it is
yes,
that causes condition B. And then they get prescribed another medication to solve
yes,
condition B, which
yes.
has another side effect. And you can see we keep going down
And
and
on it
down. And
goes.
then that's where how you get someone who's on 5 or 6 different medications for one thing, when really the root cause of something, like maybe some chronic pain, maybe they're having back issues,
Yes,
or something, right? Back or neck
right,
or hips or whatever. Like, a lot of times those are
right.
the issues that folks are dealing with,
Got it.
when maybe what they really need is a surgery to, fix whatever's happening in their back. And then, yeah, maybe they
Yes,
might need some pain medications temporarily to deal with the surgery type thing, but they may not need anything long term,
absolutely.
and definitely not 5 or 6 medications. It's just something
Absolutely.
for that short, couple weeks after the surgery to keep
Yes.
them, comfortable. Um,
Yes.
but it kills me when I see that,
I
when
know.
people are getting so many different medications and they're like, "Well, I need it." Well, do you really? If you go back to that root cause of whatever the problem is, and really
Yes.
address that instead of just
Yes.
masking the symptoms, then maybe you don't really need any of those medications, right?
I'm so with you. And there's a couple of issues here, really, which is sometimes, and addicts can be tricky. And just for your audience to know, I'm someone who's in recovery. I was a Coke addict and an alcoholic. I just celebrated 40 years of recovery. So I've been sober a really long time. But
Sure.
I also know what it's like to be an addict.
Mhm.
And we are tricky beings. And the problem is, someone will come in and they'll maybe have quit their substance, but sometimes their belief is, I want a pill. I want a pill to solve my problem. It's easier to get on a certain antidepressant, not that people don't need them, because definitely they do. But then they'll start having feelings, or they'll start having fights with their spouse. And then they think, well, I'm getting depressed, so I need another antidepressant.
Mhm.
No, you need to deal with your marriage. So it's
Sure.
like sometimes people want a pill to be the solution because they think it's easier than dealing with the underlying stuff, but it's not. Trust me. Yes.
Well, we live in a Amazon society where everything's like instant, right now,
Oh,
instant gratification.
yes.
Netflix, you want to watch a show? Boom, turn it on. You don't have to
Yes.
wait till Thursday at 8 to
Yes.
watch that show.
Yes.
You can watch
Yes.
it, right on demand. And I feel like a lot of times people
Oh,
get impatient with their physical and their mental health, and
yes.
it's okay, well, this pill worked last time, this is what I'm just going to do, I'm going to take this and I'll feel better for now, but
Yes.
it's not addressing the root cause, and it's not going to make the problem necessarily go away. It's just going to kind of mask the symptoms for now, right? And that's not the
Yes.
healthiest way to deal with it because those problems are still there and they're not going anywhere. And
Oh,
so you kind of have to deal with it, right?
you said it. I mean, the thing is, too, is that, and I always say this, like, if you just mask something, or it's just going to be this kind of, it's going to not end. It's going to keep going on and on and on, right? And then you'll get another med or another this. If you confront your pain or your underlying feelings or the underlying issues, there is a beginning, a middle, and an end, and you can get
Right.
through it. And I'm sure you've heard of Gabor Mate, the trauma guy. He's written this big book on trauma. And he really says addiction is a response to trauma. So if you look at
Sure.
all the veterans who have trauma, it's almost like a normal response, let alone, and this would complicate the thing, who they were before they even went into the service. So you've got that, then you've got the service, then you've got the post, I'm coping, I'm trying to ameliorate, calm my feelings down to this addiction. It's the only thing I know that works. But in the end, it doesn't work. It just makes it worse. So, yeah,
Yeah. Yeah,
yeah,
it does, and yeah, it's just not the right way to go, and
no,
it's hard, but you brought up something earlier too, the kind of the emotional issues that people have, anger, rage,
yes,
frustration. A lot of times we get that just from just going to the doctors and not being heard, like they're
yes,
like you're saying, "Hey, this is the problem," and they're like, "Okay, no, it's something else," and they give you
yes.
I had an experience when I had an issue where I felt like I couldn't get a full breath of air. I was taking
Oh,
was and it felt like there's an elephant on my chest. I couldn't breathe. I
yes.
couldn't get a full breath, and I was kinda nervous. I'm like, "Obviously,
Scary.
you gotta
It's
breathe
scary.
breathe, right?" So I went to the emergency room there's a VA, near here, and I went to
Yes.
the emergency room. I told them what was going on. They did all the tests, and they said, "Your blood oxygen is normal. It's, 99% or whatever." It was high. It was up there. I was doing okay, and, they said, "It must just be anxiety."
They dismissed
And
you.
I'm like,
Yeah,
I wasn't anxious about anything other than the fact that I couldn't breathe, like, that
I
was
know.
causing anxiety, but, so I did some research on my own when I got home after they discharged me with anxiety medication,
Yes.
and all my life, I had suffered with, heartburn and, like, kinda acid reflux related issues, and I never had experienced the symptoms where it gives you shortness of breath, but I looked it up, and that is one of the
Got it.
symptoms of having that. I needed, Tums or an antacid or something and not anxiety
You can
medication,
get
so
chest pain too. Yeah.
yeah, exactly, and so
Yes.
I was having a lot of issues. I took antacids, and I did some research, and I started looking into, gut
Right.
health and all this stuff, trying to figure
Yes.
out, like, what was the issue,
Happening.
um, and I eventually figured it out on my own, and nobody took the time to
Right.
ask the questions, diagnose the symptoms. It was just a knee jerk, "You must have anxiety,"
Right.
because, yes, I did
Right.
have symptoms of
Sure.
anxiety, having a panic
Yes.
attack or whatever, but,
Yes.
like, that's not what
Right.
it was at that point,
Right.
and so I could see people being really frustrated
Oh,
with this and then just trying to solve things on their own. Luckily, I solved it in a way that didn't require medications for me,
right.
but, other people I could see, well, "Hey, that medication worked. Let me
Yes.
get some more of that," right?
Yes. Yes, and oh my gosh, you've said so much. I mean, there's so many points you just made. I mean, let alone an anxiety medication. I mean, believe me, there are different anxiety medications, but benzodiazepines, which are like the Valiums, the Xanax, the Klonopin, I mean, those are highly, highly, highly addictive. And some people can take them for a short term to help with certain things, but that's such a dangerous diagnosis for someone to impulsively make and give a med. Okay, so that's my rant. But and you just happen to be someone who's super smart, inquisitive, curious, caring about yourself enough to do that. So thank God you did do that. But you're
Sure.
right. most people are fearful and they're suffering and they go to a doctor and they're looking for support and help. And I've heard this over and over and over again. And I don't know whose fault it is or where the blame is really. I'm sure that it's I'm sure there's
Oh
many
yeah, yeah,
arenas, but it's like, this idea of not being validated and not being heard. I mean, I think you can still, as a physician, validate someone's experience without dismissing them. The problem with a lot of physicians are they don't want to say when they don't know. That's
yeah,
it. And so instead of kind of acknowledging, wow, this is tricky, I really want to help you, I don't know, they won't admit that. And I don't know if it's a legal thing, but everybody wants to be like, this is the human condition. Everybody wants to be heard, seen, validated, understood, loved, all of it, right? And especially when you're suffering. So that's a really great point. And if we're going to expand this to how that connects to addiction and codependency, this is what I will say. And you mentioned in some of your questions the anger and rage. And I have a whole chapter in my book on rage because it's so important. And
mhm,
it's so connected, even more to veterans for a variety of reasons. But um, some theories about addiction are that the number one cause is resentment and anger.
mm,
So, and I'm just going to give you my own personal experience quickly. So, I'm someone that really saw myself as a very nice, caring, aware human being. And I wasn't someone that impulsively got angry. If anything, I would shut down. If I was upset, I'd more shut down. People typically do one or two things. They're either going to go in one extreme and be external, or they're going to be internal, and your audience can relate to this, or they're
mhm,
going to repress and shut down. And then there's everything in between. But when I did some work on my own anger when I first was getting sober, there was this exercise I did about resentments. And I said, oh, I don't have any resentments. And then this person said, well, they gave me this kind of recipe on how to kind of figure that out. And I had 486 resentments.
that's a huge difference from, "Oh, I have none," you're right, and I'm
Right.
making this point because there might be someone out there who's like, yeah, I have no
Yes.
resentments," but you didn't
Yes.
either, and now here you
That's
are,
right.
you said 486, and, like, that's a
Yes.
huge difference, right? So how
That's a
did you get
huge.
there?
All right.
How did you figure those out?
Well, see, this is the thing is that having someone, I mean, whatever support group, I mean, some people go to AA, there's so many online supports, there are veteran supports, but finding someone who really knows about how to process anger. And,
Mhm.
I'm going to send you a bunch of copies of my book to give out to some audience members because I have a bunch of exercises in the book on how to process these resentments. And it's really helpful. And because, again, underneath addiction is to me is anger, fear, pain, shame. At the bottom is really, I think, powerlessness, but and fear. Fear is a
Mhm.
biggie. And if you look at codependency, which we'll talk more about those symptoms, underneath codependency are all the same things: our anger, shame, resentment, the need for control. So literally underneath addiction and the symptoms of codependency are the same kind of unresolved emotional worlds. So how to deal with your anger, and the tricky thing about anger is this is anger. I have a saying, and I was thinking about this, does this relate to veterans? And God, we'll have to do a group or something for a group of people because there's just so much to talk about. But I have this saying that 95% of the time you get angry, it's not about the present moment.
Mm.
So, and you asked in one of your questions, so what typically happens? And let's just put trauma and PTSD aside for a second. What typically happens is someone will say something to me. I'll use you as an example because you gave that example with feeling dismissed. So, say you're out in the world and you're talking to someone at a store and they do the same thing to you, meaning you're asking for a certain car part or something, and they dismiss you and say, we don't have, and you have this intense anger reaction. So the question would be, geez, why am I having an intense reaction to this store clerk right now? And that's how anger works, right? What happens is they're triggering a memory in you, a bodily sensation of another time you've been dismissed or not been heard. And it could have been 30 times in your life. And all those hurts are in your system. So what happens is this store clerk says something and presses that button of I'm not being seen, right? And it could happen when you were 5 years old with your mom or your dad. I mean, not that they meant to, but hurts
Sure.
happen. And those accumulate, and then someone presses that button and you get activated. So, the question I say to people when you have what I call an activation of anger is you say to yourself, what is this reminding me of? When have I felt this way before? And what is the underlying fear? So usually what happens is it activates a fear of not being seen, a fear of not being good enough, fear of not getting my needs met, fear of not getting what I want. There's all kinds of possibilities. So anger and fear are highly connected, very correlated. And you can put that now in a veterans camp and think about, oh my gosh, anger and fear are going to be, when I read your book, that these are the things I was thinking about, because anger and fear are magnified all over the place, and yet you're supposed to contain it. So
Yeah.
you're out in your world as a soldier and you're trying to contain all these feelings, but eventually they're going to still be there. The consequences in your system, they're going to be there. You come home and they're going to get activated, right? I'm saying a lot, but you tell me what you think about all this.
Yeah, I get that, what you're talking about, because you do have these things that need to be, I call it compartmentalized.
Yes.
When you're out on a
Yes.
mission and you're
Yes.
going through some personal stuff, maybe someone's having a fight with their wife or something like
Yes.
that, or they're getting a divorce, or they're something's going on back home. There's some personal issues going on. You you got to put that stuff aside, and you got to have a
Yes.
clear head and be focused and pay attention
Yes.
to what's going on around you.
Yes.
Otherwise, that's how people get hurt or killed, and that's
Yes.
nobody wants that, right? But that's how it happens. And so when we can't figure out how to compartmentalize it, then those bad things happen. However,
Yes.
when they are compartmentalized, we need to figure out how to go back and like open up that box and take that stuff back out and deal with it at some
Yes.
point. We can't just, oh, you know what? I feel good right now because I stuffed that down and it's
Yes.
in its, quote unquote box, and it's put
Yes.
away. I don't have to think about it anymore. It's not like,
Yes.
old gym shoes that you put in a
Right.
box in storage or anything. It's something that you need to take out and you need to deal with. And
Yes.
find to compartmentalize in that moment when you need it.
Appropriate.
Um, it's
Yes.
a completely appropriate, I think. Um, and I wrote about that in my book of,
Yes.
how I was dealing with the grief of losing my brother, but then
Yes.
we were in a firefight. And it's like, well, I can't be sitting here sobbing and crying as
Right.
people are shooting at us. Like I have
Yes.
work to do. I have to go do my job as a soldier. And so,
Yes.
yeah, but then now people stop shooting. Now what do I do?
Now
Now I
what?
have to go figure out that grief side of things and take that back out of its box and figure out how to deal with that, instead of just keeping it shoved down and you know
Oh,
uh, and dealing it with it in that way. That doesn't
yes.
really help anything. So yeah, that's kind of where I see, kind of what
Yes.
you were just talking about there, is that yeah, there is a time and a place to compartmentalize these things, but you need to figure out how to deal with them too. And that
Yes.
goes, I think, back to the root cause issue, like we were talking about with the medications earlier, where
Yes.
if you're not dealing with that root cause and you're just doing something temporarily to mask the symptoms, then
Right.
you're not actually dealing with it,
Yes.
the way that it should be, right?
Right. I mean, we can just generalize it, Scott, and say emotional pain, right?
Mhm.
So addiction is numbing emotional pain, regardless of the origin, whether it's a trauma from service, whether it's a childhood wound, whether it's, I had a client who had a football injury and lost a scholarship, things happen, right? Things happen that are painful. And, especially for men, I would say, and I know I'm going to maybe get in trouble for this, but the idea of like not being able to process it and needing to be a tough kid and all that stuff, and then you go into the service and there's going to be more compartmentalizing, more
Right.
repressing, and then you come out and you start becoming kind of volatile or reactive. Gee, why? Well, I've got years of stuff that I've repressed, and now how do I process them? How do I let them come out slowly? How do I put down the alcohol or whatever the substance is so I can start dealing with this? And you brought up a whole other topic, which I thought about for vets and for human beings getting sober is grief. I mean,
Yeah.
grief is a huge underlying issue. And, I do think, especially for vets, God, I think about my dad. I mean, my dad, every Veterans Day, would break down sobbing.
Mhm.
And, and and he would talk about people, his best friend whose head, was lost next to him. And, my dad got a Purple Heart and saw combat, and, he was still severely affected and severely, crippled by that grief years later.
Right.
So it's really important to have a place to process that and have a safe place. Go ahead.
Yeah, absolutely. The being able to deal with that, you hear about this all the time, World War II veterans, Vietnam
Yes.
era veterans, Korea, they're dealing with stuff, but back then, especially, gosh,
Right.
I couldn't imagine. You're coming back and, you're just told to just suck it up, be a man, deal with it, that type of stuff.
Right.
And,
Right.
like, that's not helpful. Like,
Right. There
you
was no name
you
for it, I think, back then.
yeah,
I
and I
mean,
mean,
yeah,
maybe it was like, shell shock or,
shell
things
shock.
along
Right.
those
Right.
lines, right? But
Right.
that wasn't, th that was, like, I think the label that they gave to, like, the extreme cases, like,
Yes.
the person who's
Yes.
sitting in the corner, in the
Right.
fetal position, shaking and,
Yes.
kinda mumbling to themselves, like,
Yes.
that was shell shock back then, but there was
Yes.
a whole lot of other people who were dealing with,
Absolutely.
PTSD, which just didn't have a name back then,
Right.
and
Right.
all they were told was like, "Well, just deal with it. Like,
Right.
you gotta come back home, and you got a family to provide for, and you have
Right.
a job to go to, and you have this, and you have that, and that's what you
Yes.
gotta do." And okay, that's what they did. But,
Right.
how much
Right.
better would they have been? And we're talking about, like, the greatest generation, right? But think about how much greater they would have been if they had some sort of support to get them
Right.
through, some of these difficult situations. Now I wanna talk, I briefly mentioned, like,
Yeah,
families
sure.
and stuff, but I wanna talk about, a little bit more about the codependency, right?
Yes. Yes.
Because I mentioned that, obviously, it's a good thing to care for a loved
Of
one
course.
who
Of
is
course.
struggling with something. You gotta care for those people and help them, marriage and sickness and in
Yes.
health, like, we're gonna be
Of
there
course.
for each other, right?
Yes.
But
Yes.
there comes a time when it becomes a problem for the
Yeah.
let's just call it the caregiver person, the
Yes.
person who's giving care to
Yes.
that other person, where now that person's whole identity, their whole life is kind of focused around helping this person. How do we identify that?
Right.
When are we approaching that it's becoming a problem? And
Right.
how do we deal with that so that it doesn't become a problem? Kind of go back to that root
Yes.
cause. How do
Yeah.
we get to the point where it's not a problem for that caregiver type person?
Yeah. Well, getting some education about what it is, how it affects me, the kind of delusional system around it is really important. And that's what we're talking about. I mean, the thing is, I believe, and that same psychiatrist, Gabor Mate, wrote a book called When the Body Says No. And basically, his second book was about all these physical illnesses. And he talks about the physiological changes that happens in your system when you're focused just on someone else.
Mhm.
Like that whole book, literally, to me, is about the consequences of codependency. And I believe codependency kills people because I've known people, and this is extreme, right? If you if you spend years focusing, say you did it in your childhood, say it started in your childhood where your mom was depressed or your dad was an alcoholic, for example.
Sure.
So what you learn in that environment is, I need to be hyper vigilant to my environment. I need to focus on what's happening out there with these folks for me to be safe, because
Mhm.
everything's up in the air. And a lot of people grow up kind of in chaos. And I mean, listen, parents aren't perfect, and there's all kinds of mental health issues and addiction issues and trauma issues. So everybody has something. So if
Yeah.
you grow up focused on what your parents need or your siblings need rather than what you need, it's going to set the seed for other people are more important than me. And I'm not talking about just being compassionate. I'm a compassionate person. I'm talking about where the focus is really on what they need, how to fix them, how to change them, how to save them, how to get them well, how to save them from their addiction, how to get rid of their depression. It becomes like my partner's problems now become mine.
Yeah.
And yes, the problem with that is the codependent person has severe consequences. So what's going to start happening is I'm going to start getting depressed. I'm going to start getting chronic headaches. I'm going to start having panic attacks. I'm going to start drinking. Like the codependent literally starts having all of the same symptoms and, really loses touch with their own self-care.
Right.
The first symptom that is someone a codependent is their self-care goes down. And people will stop going to doctors and stop taking care of themselves and say, oh no, my husband needs this or my partner needs this. The other codependent arena that we're not even discussing is parenting. Oh my God, don't get me started. Parents these days are so codependent. Your book was great because I think the idea of self-reliance and independence and stuff like that, but so many parents, because of their own fear now, are way too involved in managing their kids' lives rather than letting them have consequences of their own behaviors.
Right.
So
Right.
that's what codependency is I'm going to try to stop you from having a consequence. So the classic example was like, say my husband drinks too much, and the next day his boss calls, I lie on the phone. I say, oh, he's sick. So I start kind of trying to cover up and manage my partner's illness.
Yeah.
And again, the big lie that I talk about in my book is I can't manage my partner's illness. I can't get them sober. I can't get rid of their depression. I can't solve their problems. I can be supportive, but they are the ones that have to do that, right? You
Right.
know that. I mean, my partner has to figure out his depression. And in fact, the more I bug him and try to, like, I got a bunch of different things going on in my brain, but I had a client once who had a daughter who was a substance abuser, and she came in with two lists. And one list was about 25 things of things she told her daughter to do. She made a doctor's appointments. She got her into treatment. She did, and literally the daughter had done none of them. And
Okay.
the other list was five things. And the daughter had done all of them. And the reason is because they were the daughter's ideas. So that kind of gives you a feeling for, all codependency does is ruin relationships, really, because one person is trying to control another and the other just gets resentful. Now, does it come from a good place? Well, yeah. You love someone and you think, oh, I see that they need to get sober, so I'm going to make an appointment with or whatever, you know. So you're trying to be helpful, but in the end, most of the time, it doesn't help the other person and it doesn't help the codependent. Okay, you probably have
Yeah,
lots of questions.
I do. Yeah, and so to me, it's like they almost need to see the light for themselves. They need to figure out, they being the person who's addicted or the person who has a problem, whatever the issue is. Maybe it's a
Yes,
PTSD, maybe it's a drinking, maybe it's a drugs, maybe it's a
yes,
something that whatever
yes,
it is. They need to see the light for themselves, and they need to figure out that, oh my gosh, yeah, that is a problem. That's not the type of person I want to be. I want to,
right,
you know, I want to be able to be, supportive and provide for my family and
right.
and do those types of things. But they need to figure that out on their own because if you think about even just sitcom television, you got like
Yes,
the nagging wife who's
yes,
always telling the husband, "Oh, take the trash out,
yes,
do this,
yes,
do that,"
right,
whatever. And the husband's just like, "Oh my god,
right.
really? I got to listen to this again." And they start to tune it out. And even if
Yes,
what the person is saying is 100% correct, 100%
yes,
accurate. Yes, you need to get sober, like you absolutely do. Um, yeah, but
right.
you keep nagging me about it, I'm gonna start tuning it out, and all of a sudden, now we're switching it from, "Hey, we have this equal partnerships, and when we're there, we're in it together for each
Yes,
other," and now it becomes, if they tell me to do anything, I'm gonna do the opposite,
right.
or,
Yes,
I'm gonna do that thing even harder if they tell me
yes,
not to, just
yes.
in spite of them, and that's not a healthy way to have any sort of relationship with someone
No,
either. And so when you have these types of situations, you really do have to, um, just I think, be open to the fact that things are not gonna be perfect, but
right.
you might you might be able to have better luck if you can them see help them see the light.
All right.
I don't know how else to put that, but hopefully that makes sense.
It totally makes sense. And I'm going to tell you how you help them to see the light
Okay.
is you stop trying to save them. So this is the thing. The only way that my partner is going to want to get sober is if he or she has consequences of his behaviors.
Mhm.
If I keep jumping in and saving and fixing and managing, they're not going to have any consequences.
Right.
So that's called enabling, which I'm sure you've heard that term,
Uh-huh.
right? And this is the counterintuitiveness of codependency recovery. The solution to getting my partner sober, okay, is focusing on myself. Okay. I know that sounds crazy, but seriously, when I start shifting the focus to taking care of me and letting them do their thing, have consequences of their behaviors, suffer the consequences, have their feelings of, oh my God, what is it like to miss work? What is it like to not be there for my son? What is it like to miss that baseball game? What is it like to, wake up in my car outside rather than my wife coming out and getting me? I mean,
Yeah.
this is the stereotype, but still, when you allow the person to really feel what they're doing, then they're going to want to get sober. They're not going to get sober because I'm telling them to. They're going to get sober when I stop telling them to.
Yeah.
That's the counterintuitiveness.
In my book, I wrote about how with my PTSD and the grief that I was going through and all the
Yes.
anger issues and everything like that
Yes.
that I was going through. My wife wasn't really ever nagging me about,
Got it.
"Oh, go get help, go do this, go do that," and it was never a nagging situation. You have to, or
Right.
blah 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 blah.
Right.
Right? It was one of those things where she just kind of like gave me the space to do what I needed to do.
Yes.
And eventually I came to that conclusion on my own that it's like,
Yes.
this is not working. This is not the type of person I want to be. I don't want to be
Yes.
angry all the time. I don't want my son growing up with a angry dad who's yelling all the time and screaming and, just seems like he has to
Yes.
walk on eggshells just to be around me. And like, that's not
Yes.
the type of person I wanted to be. I didn't want to be that for my wife either,
Yes.
or really anybody else. But that's who I was at that point.
Yes.
And so kind of came to that conclusion, uh, on my own, and I was like, this is not the type
Yes.
of person I want to be.
Yes.
And so the next morning, that's when I called and got help,
Yes.
and I
Yes.
made that appointment, and that was, to me, that was scary
I
to do,
bet.
and you know. That's your typical guy, essentially
Yes.
a soldier who's
Yes.
basically the fixer. You go out and help
Yes.
other people, and now I'm asking for help to fix myself, like, that just doesn't
Whole other
compute in my
topic.
head, right?
Yes.
Yeah, yeah.
Yes.
So that's I think what people are dealing with. I know, in at least in my situation, it sounds very similar to what you were describing, but that's just kind of what we deal with, and we need to kind of break that cycle and not
Yes.
have the pressure on ourselves to go and
Yes.
fix somebody else.
Yes.
We can do this by working on ourselves, improving ourselves, and a lot of times when you're in an environment where people are excelling and succeeding, it's like, well, hell, I want that too,
Right.
and
Yes.
how do I do that? And you start emulating kind of the things that they're doing. It's
Right.
like, okay, well,
Right.
they're taking care of themselves, they're doing the things that they need to do. Well, what are the things that I need to do? And you
Yes.
start figuring that out, right? So,
Yes.
um, I know we're kind of getting close on time here, so I want to give you a chance to. You mentioned your book. I want to give you a chance to talk a little bit about that. Tell them what the book's all about, where they can get a copy, all that kind of stuff.
Sure, sure. So I wrote a book on codependency and addiction. It's part memoir and part self help. So anybody that struggles with codependency or addiction, it's called Co Crazy. And the reason I call it Co Crazy is because most of my patients who come into my office with relationship problems, they say they feel crazy.
Yeah.
That's what they say. Because when you're trying to fix someone else, and meanwhile, both of you are getting worse, it's very hard to figure out what the solution is. So it's called Co Crazy. You can get it on Amazon. I also have a website, drsarahmichaud.com. And there's, lots of support on there, some podcasts. I have a YouTube channel called Leaving Crazy Town. You can email me, questions, whatever. I'm there to help. So absolutely.
Excellent. And
Yes.
I will have links to all of that in the show notes too for folks who
Great.
are interested in checking it out. Check out your website, the book, that type of stuff. I'll have all of those links in there. Before we wrap up this episode, I always like to end an episode with a little bit of humor.
Yep.
I think humor could be the best medicine, and I don't think you can abuse that or overdo it with that. I think that's one of those safe medications with, the only side effects are good side effects, I think. And, I try to be funny, when I tell these jokes. Sometimes they flop and they're not all that funny. And if you wanna laugh at me, that's fine too. I don't care. As long as I get someone to laugh, that's all good. So, here's a joke. So there's a kid. He's going to his first day of school, and he looks around, he looks worried, and his dad asks him, what's going on? What's wrong?" And the kid goes, "Well, how long do I have to go to school for?" And the father says, "Well, until you're 18." And the kid nods his head and thinks about it, and he got to the front gates of the school, and the kid turns around and asks his dad, "Dad, are you gonna remember to come get me when I'm 18?" Which I think the reason why I thought that joke was a good one is because, kids, like a five-year-old kid going to school for the first time,
Absolutely.
they they don't have concept of time, like how
Time.
long is 18 years and all that. Like, it
Oh,
just is a kind of foreign concept almost to them. I thought about my own kids, like, as, we're bringing them to their first days of school, and, what their thoughts were, like, as they're getting dropped off, and,
God,
um, you
yeah.
know, we never really talked about that, but, they know they know now that they don't have to wait till they're 18 at least. We
Absolutely.
will come and pick them up. So,
That's
um,
right.
anyways, thank
Humor is
yeah,
such a great coping skill.
it
You
is,
know,
it is.
yes.
I think that's something that we need to do. Actually, my kids, for Father's Day, I got this book of dad jokes. They're extra punny, so, um, I am going to be utilizing some of these in future episodes,
Excellent.
and, um,
Excellent.
yeah, we can throw another one real quick, a quick short one. When's a door not a door? When it's ajar.
God. Yeah, those are definitely gonna be the punny dad jokes.
Those
I
are the
so
ones
appreciate it.
that's what everyone has to look forward to, with this show, and I could see, like, the listeners are just gonna tank after that, after I made that announcement.
It's so
You know,
important
at
though,
least the eye rolls are gonna start, they're gonna
it's so critical, in my work and even on my YouTube channel, I do it with an attorney who's been
Sure.
sober. And the reason we do it is because we try to have fun talking about really serious topics. And this is
Yeah,
the same with your podcast. You're talking about trauma and PTSD and addiction and homelessness and all these things. And it's really important to kind of pull the lens back and get a bigger perspective. So I appreciate it.
I love it. I love it. Good perspective there. So thank you. And
Yeah,
thank you for taking the time to come on the show. Thank you for your book and the work that you do. And you said you're going to get a couple copies over this way, and
absolutely.
I'll do something, maybe a giveaway or something on social
Yes.
media, and get some folks who want to grab a copy of that book, and we'll get some interest out about that. So for the listeners, stay tuned for that, and check out that giveaway when it comes
Yes.
out. So thank you again, Sarah, and
Thank you
looking
so
forward
much.
to chatting with you again. I appreciate it.
Yes, absolutely. Let me know anything you need. This was a pleasure. Thank you so much.
Thanks for listening to the Drive On podcast. If you want to support the show, please check out Scott's book, Surviving Son, on Amazon. All of the sales from that book go directly back into this podcast and work to help veterans in need. You can also follow the Drive On podcast on Instagram, Facebook, Twitter, LinkedIn, YouTube, and wherever you listen to podcasts.